Good afternoon, Dr. Corey Moss, drmoss.com on Looking Your Best. Today I thought we'd spend a few minutes answering some questions that came up just this week with blepharoplasty or eyelid surgery patients. And these questions were very germane and are repeated very often, so I thought I'd share them with you. And then if you have any questions that are add-ons to my comments, please feel free to write or send a video or a photograph, and I'm happy to comment on those, and you can do that either publicly or privately at drmoss.com video blog. The first question that came up was, are there alternatives for saggy or droopy eyelids to surgery? Are there things that are reasonable to do that can improve eyelid contour? And the answer is absolutely yes. And I break this down into two categories. The first category is upper eyelid surgery. The second category would be lower eyelid surgery. With upper eyelid surgery, there is a redundancy of skin there that goes along with the brow drooping down, as well as this saggy or dermatocolitic skin. That's sort of the crepey skin of the upper eyelids. There can be some improvement achieved with skin resurfacing, either with a laser or chemical peel. Skin resurfacing I've described before as a way of selectively injuring the skin surface down to the second layer of the skin, the dermis, and stimulating a wound healing process that actually improves the skin by creating new collagen, remodeling the existing collagen, and actually forming new skin cells or regrowth over the skin surface. So some tightening can be achieved with skin resurfacing, but I think it's really often overplayed by resurfacing and laser experts. There's some improvement in terms of tightening the loose skin, the fine lines and wrinkles, but it's far from perfect if there's a lot of redundancy to the skin. Obviously, doing a surgical procedure for the eyelids has its unique benefits and some downsides in terms of recovery. So resurfacing is one of those alternatives. Another alternative might be to use botulinum toxin, and that comes in a couple forms, now 3 really currently available in the United States. Botox Cosmetic, which we all know about, Dysport, which is now a Valiant product, and lastly Xeomin, which is made by the Merck company. All these are type A neuromodulators or botulinum toxins, and they do the same thing around the eyelids. If we inject the area of the lateral crow's feet region, this is the orbicularis oculi muscle, we can relax the muscle that is primarily responsible for pulling the eyebrow down. Pulling the eyebrow down obviously creates some hooding, and by relaxing the muscle that's pulling it down, we can actually get some brow elevation, and that can reduce the redundancy. So those are some non-surgical alternatives in improving eyelid contour. And again, really saggy eyelids have to be addressed with your doctor individually, and whether you use resurfacing, botulinum toxin, or even doing an injectable filler, which is the third or last of these options, are up to you and the physician you're working with. The last one I mentioned is a little bit controversial, or is very specific to individual physicians and their use, and that is placing a filler like Restylane, Juvederm, Radiesse, or Belotero underneath the eyebrow and just inferior below the eyebrow in order to create some volume and a little lift of the brow itself. It's controversial because it can also create some thickening or frontal bossing, so it has to really be done in the right patient. A little swelling is involved in it, but in the right patient this can be a nice way of elevating the eyebrow, which translates into a little less redundancy of the skin of the upper eyelid. So kind of a long question, but 3 options we really talked about in terms of addressing non-surgically the eyelid. Option number 1, resurfacing. Option number 2, botulinum toxins, Botox, Dysport, Xeomin. And option number 3 is using a filler in the infrabrow, below the brow and region, to help to create some volume. So thanks for asking the question. Thanks for the opportunity to answer this question. And if you have any other questions, don't hesitate to write drmoss.com at the drmoss.com blog. Visit our website at mossclinic.com, or even our Facebook page at facebook.com/mossclinic. As always, thanks for coming and visiting. Dr. Corey Moss on Looking Your Best.